Influenza has had a lot of people worried lately. With the swine flu affecting people all over the world with fatal consequences, we have all been paying more attention to influenza outbreaks. But did you know our canine friends have their own potentially scary virus going around? If your dog is coughing and sneezing, you don't want to shrug it off as just kennel cough. There's a new flu virus spreading rapidly across our country, and it has already killed dogs in several states. It usually starts out with coughing and gagging that can last for weeks. Infected dogs can develop a fever from 103 to 107 degrees. And since it's a relatively new virus in dogs, virtually every dog exposed to the virus could be infected. And like most flu viruses, it can be spread by air as well as close contact. The good news is there is now a newly developed vaccine for canine flu from your veterinarian. The injection needs to be given under the skin twice, 2 to 3 weeks apart, to get the best immunity. As with all vaccines, we must assess the risk of disease for each pet individually. However, if you take your dog to a boarding facility, daycare, the groomer, obedience or agility classes, dog parks, or even a walk where other dogs have been, there is risk of exposure. This encompasses most well-cared for and well-socialized dogs. If you need to board your dog, make sure the facility is clean, well-ventilated, and requires all dogs to be current on their vaccinations. Consider boarding at a veterinary facility so that a doctor can begin to treat any ailment as soon as it is noticed. This canine influenza virus can be fatal, but only in a small percentage of cases, and it is not thought to be contagious to people. It is important to remember that many common diseases look just like canine influenza, so don't panic, but have your pet examined as quickly as possible if something is out of the ordinary. I'm Dr. Tony Kramer. To learn more about canine flu, check out drtony.com.